At present, Rotunda recommends all patients who is a suspect of COVID-19 to call our COVID helpline, which the number is available on our Rotunda website, and inform us so that the COVID helpline staff will advise you, and we usually book you through a red zone clinic so that we will be able to protect our other patients coming through our system and our staff. So if you have diagnosed with COVID or you are awaiting a test result, or you have any signs and symptoms like fever, a new cough, shortness of breath or loss of smell or taste, or if you have been abroad in the last 14 days, or you had a contact with a confirmed COVID case, you have to please ring us on our COVID helpline on 0181725575, and we can arrange your care to keep you and everyone else safe. All the elective patients getting admitted in Rotunda, we are facilitating COVID admission swab PCR testing through our drive-through department. We have a drive-through department where they organize us and call in the patient within 48 hours of the planned admission. All the patients are getting appointments and get the swab and the swab results before 24 hours. At present, we are doing a point-of-care molecular COVID swabbing test for all unplanned admissions through the emergency department and through the daycare unit. If any of our pregnant woman is getting admitted as an unplanned schedule, we do a point-of-care test in order to do appropriate patient placement. We get the result in 15 minutes. If the point-of-care machine test, COVID swabbing test is positive, we send the sample again for a PCR testing to the lab, and we isolate the patient awaiting on the COVID swab test. So if you are diagnosed with COVID-19, you will be isolated in a separate isolation room with enhanced droplet precaution, where your staff will be wearing PFF2 mask and appropriate PPE for enhanced droplet precautions. Your baby will be looked after in an incubator. Whenever you have a contact with your baby, infection prevention and control team in Rotunda recommend you to have appropriate hand hygiene and wear a surgical mask when you are looking after your baby. Yes, of course, you can still continue breastfeeding when you are COVID positive. We recommend all our postpartum women to continue breastfeeding during COVID-19 infection in order to promote the immunity to the child. And if you are vaccinated, it is through the breast milk the baby is protected with all the antibodies. Vaccination is the most important method to prevent COVID-19. We recommend you to have at least 14 days restrict movement before getting admitted in Rotunda in order to prevent the risk of contracting COVID-19. Appropriate hand hygiene, appropriate mask wearing and social distancing is very important in the prevention of COVID-19.